Welcome to How to Find More Direct Clients Than You Can Poke a Stick At podcast, a mix of both solo episodes and expert interviews. Our ideal listener is an early career, ambitious, and passionate online language services provider. She is committed to professional growth and achieving success in the fiercely competitive translation and interpreting industry. She balances multiple responsibilities with resourcefulness, values mentorship, is open to learning, and investing in her professional development journey. She embraces technology and seeks to optimize workflow, eager to connect with like-minded peers and build out her professional network. She is determined to overcome challenges and become a sought-after freelance translator. And here's your host, medical translator and translator business mentor, Jason Willis-Lee.
Welcome to the show. I'm Jason Willis-Lee. Today I'm speaking directly to experienced medical translators thinking about how to stay ahead of the curve professionally, strategically, and even economically. In this episode, we're diving into a niche gaining serious traction in the clinical research world now. It's linguistic validation, or LV. Now, if you're not yet familiar with this area, please stay with me, because by the end of this episode, I want you to walk away with a clear understanding of why LV could be one of the most future-proof moves you can make as a medical translator, or even if you're not a medical translator. Let's get into it. The first point is rising demand from pharma and CROs, contract research organizations. As clinical trials globalize, the expectations on translated patient materials are changing. It's no longer enough for translations to be accurate. They must also be culturally valid and conceptually equivalent. That's exactly what linguistic validation is designed to ensure. It's a process used to adapt things like quality of life questionnaires, symptom diaries, and other patient-reported outcome measures for use across different languages and cultures. And here's the key point. Pharmaceutical sponsors and CROs are investing heavily in this process. If you translate into Spanish, French, or German, languages seeing increasing trial activity, you're in a particularly strong position. So the takeaway is you already have the subject matter expertise. Learning LV gives you access to a growing, well-funded niche. The second reason it's a good pivot is it's a natural extension of MedTran, medical translation. Now, you might be thinking, do I need to retrain entirely to do this? Not at all. LV builds directly on the medical translation skills you already have. You'll still be working with clinical content, but now with an added focus on cultural nuance, regulatory alignment, and patient readability. If you've worked on informed consent forms or patient leaflets, you're already much closer than you think you are. So the takeaway is that LV adds a new layer to your existing skill set, one that values clinical knowledge and cultural sensitivity in equal measure. The third point is a greater strategic involvement. One of the major differences with LV work is that it tends to be more collaborative. You might liaise with sponsors, engage in harmonization sessions, or even contribute to how source materials are developed. This positions you not just as a translator, but as a consultative expert, someone who shapes how clinical content is localized and validated. So the takeaway is you become more embedded in the project lifecycle, and that deepens your value to clients. The fourth reason it's a good pivot is regulatory expectations are rising. So let's talk about compliance. Bodies like the FDA, EMA, and ISPOR, the Pharmacoeconomics Organization, now expect sponsors to prove that their translated materials are not just accurate, but they're also functionally equivalent. A flawed translation can delay trials or compromise data integrity. Your role as an LV specialist becomes essential to maintaining the trial's validity. So the takeaway is LV isn't a luxury, it's a regulatory necessity, and that elevates both your strategic importance and your rate card. And the final reason it's a good pivot in the AI era is resilience in a post-AI world. So I'll be very candid. AI is transforming the translation landscape, as we all know, but LV remains a human domain. It requires sensitivity to language, emotion, and cultural nuance. And these are all skills AI can support, but not replicate. So as more routine tasks get automated, LV stands alone as a space where your expertise becomes even more valuable. So the takeaway is this isn't just a smart move, it's a defensive one. LV puts you in a category where machines assist but don't replace. And closing thoughts, there you have 5 reasons why pivoting into LV could be one of the most strategic decisions you make as a medical translator, or even a non-medical translator. I have a client who is a market research translator going into this niche. It's collaborative, intellectually stimulating, it's in demand, and insulated from many of the risks facing our profession today. If you're ready to specialize further, future-proof your income, and deepen your value to clients, now is the time to take a closer look at LV. Thanks for tuning in to this week's episode. If you found today's episode helpful, please subscribe or share it with a colleague. I'm Jason Willis-Lee, your host, and I will see you next time.
Here's a fun fact about Jason. Jason is a big Star Wars fan. Thanks for tuning in to the How to Find More Direct Clients Than You Can Poke a Stick At podcast. We'll be back soon. In the meantime, why not head over to www.entrepreneurialtranslator.com to access all our tools and resources to monetize and future-proof your freelance translation business. And don't forget to hit the plus button in Apple Podcasts or iTunes, or subscribe in Spotify to be notified when new episodes drop. For regular tips and insights, business strategy, or marketing techniques straight to your inbox, please sign up at www.entrepreneurialtranslator.com.